My name is John Guzzo and I'm an orthopedic surgeon at Lakeshore Bone and Joint Institute. I went to medical school at the University of Pittsburgh School of Medicine. I was in the Army for just under 10 years. I spent 5 years at Fort Lewis near Seattle, Washington during residency and subsequently moved to Fort Stewart down near Savannah, Georgia for the next 4.5. After I finished my time in the military, I moved back to Pittsburgh where I was born and raised and spent 3 years before one of my old Army colleagues, Dr. Plank, had called and recruited me out to the area. I've been practicing here for the past year. I got into medicine in order to be able to help people and significantly change their lives for the better. As a child, I experienced several life-altering events through my family and saw how the physicians helped to change both the lives of myself and my family members through their interaction with us. The thing that I like best about being a surgeon are the smiles that I see on my patients' faces after successful treatments and surgeries. I also greatly enjoy the fact that I love my job. Who doesn't want to wake up and feel excited to go to work? As a general orthopedist, I perform a multitude of surgeries involving both the lower and upper extremities, from arthroscopy to total joint replacements. As I said before, I am also certified in sports medicine. Sports medicine means different things to different people, from treating elite athletes to the weekend warrior, to the aging patient that wants to remain active. I believe that patients should come to see me because I don't treat patients as a number or a diagnosis. I believe in treating the patient as a whole. You can't just treat an x-ray or a lab result. You have to listen to the patient, learn about their symptoms and their situation. This information, along with all the other pieces of the medical puzzle, lead to the optimal treatment for each patient. The practice of medicine should be personalized for patients to get the best possible care. Even the same diagnosis might not warrant the same treatment in 2 different patients. Every patient and their condition are unique. Patients should come to see me when they have musculoskeletal conditions that affect their quality of life, their job, or their normal daily activities. When I'm not working, my #1 priority is my beautiful family. I have 4 amazing children and a wonderful, loving, understanding wife. If I have any free time beyond work and family, I enjoy attempting to stay in shape and catching up on the latest technology that affects our lives. LBJI is different from other practices simply from the quality of care that we offer for patients. During my time in the military, I had the opportunity to travel and see a lot of different medical treatment facilities. I can honestly say that I'm honored to be part of such an elite organization. My philosophy with workers' compensation is to provide the patient with work restrictions so that they can return to work and be a productive part of the organization without endangering themselves. I believe that an insurance adjuster should send me patients because I consider myself to be very conservative in medicine. I'm not just going to immediately sign a patient up for surgery without considering the alternatives first. That being said, if a patient does need surgery, one of the things that we think about is trying to get them back to work in a timely fashion. Therefore, we can get the best result with the least amount of treatment. I guess in the end you could say less is more.